Hey, this is Dr. Mack. You know, I get so many emails about various sexual health issues, especially STDs. And because herpes is on an ever-increasing rise, I thought it'd be a good deal to talk about herpes today. So I brought in my clinical partner in crime, Dr. Keith. He's a prominent OBGYN folks in the Maryland area, and I thought he'd be great to give us some information on herpes. I mean, you know, in dermatology, I see that in patients with clinical vesicles, clear blisters, and things of that nature. But Dr. Keith is our expert on this topic, so I'll let you handle it for him.
Thanks for inviting me, Dr. Mack. It's been a long time coming. I'm glad to be on your show. This is a good topic because I get a lot of questions on herpes. And herpes is a very prevalent STD, and it's an important one to know because not only is it on the rise, it's something that a lot of people have already been exposed to. So
right.
the more you know about what's out there, the more you can protect yourself, okay? Herpes typically presents with some sores around the genital area. The first time you get this exposure to this, it can be very painful. Mm-hmm. So if you ever see sores or patients see sores that don't look right to them, they need to get in to see their doctor so they can be evaluated and treated for it. Unfortunately, herpes is one of the STDs that once you've been exposed to it, you can't get rid of it. So I always tell patients to protect yourself, use condoms, because your sexual health is just as important as your regular health.
Right, we need to say that part again. Hey folks, I really want you guys to remember, you gotta wear condoms, gotta protect yourself, because this could really actually save your life, to be honest with you. So, you know, Dr. Keith, you have any other additional things that our viewers need to know about?
Like I always tell my patients, ladies, you gotta protect yourself. You know, intimacy is a very important thing, but when it comes time, you need to turn the lights on. You know, if I shook your hand,
right.
if I reached out to shake your hand and I had a whole lot of bumps on my hand, you probably wouldn't shake it.
Exactly.
It's the same thing. It sounds corny. It doesn't sound, you know, like it could interrupt.
Maybe that initial first foreplay stage, keep the lights on a little bit so you can peek out what's happening.
You know, you need to turn the lights on so you really know what you're dealing with.
Right.
So I always tell ladies, do that and think about it. You really want to think about, you know, what you're about to get yourself into, because sometimes when you step off that ledge, it's no coming back. And I see a lot of patients that say to me, you know, just what if I would have done X, Y, and Z? So
right.
just kind of think about it. And if you're with a partner that really cares about you, then they'll want to do the same thing.
Right.
So,
and understand, with herpes, there is no cure. So it's going to be a recurrent issue. You have to have constant chronic treatment. So I think, you know, the sooner that you kind of just learn to protect yourself in the first place, boom. Hey, abstinence is the best, folks. So that's not always fun, though.
Right. So if there's any take-home messages, I always tell my patients those 3 words: think about it.
Good deal. I hope you all learned a lot about our sexual health topic today, herpes. We will be covering more topics. If you have some issues that you specifically want me to answer, or my buddy Dr. Keith to answer, email me through my drmacklin.com website, which is drmaclin.com. Bye-bye.